in our health in relation to our families. This is because of genetics, because of social issues, because of our family relationships, and so on and so forth. Then on universal healthcare, as you can see, we'll discuss the definition. We'll want to understand the objectives of UHC. UHC is a key thing, even Kenya is practicing it, although in some facilities it's not yet been rolled out fully, but it's something that you as individuals, when you qualify, when you start practicing, this will be your core element as clinicians on universal healthcare. It has several pillars, it has a way, it has a whole booklet of universal care, universal healthcare, how it is being enrolled, how is it practiced, how is it implemented in our daily lives. Now, under universal healthcare, there are key components that we will discuss. This is healthcare financing. How does Kenya or the Ministry of Health acquire financing to finance its health? How is dispensaries, health facilities that you're going to visit during the rural, how do they make money, or how do they get monies? And the important to note here is there will be an aspect of insurance that I want us to discuss. Oh, it's there in the last bit, risk sharing in health, NHIF. We'll look at the laws, we'll look at how these NHIF funds, or how does facilities get NHIF, how is an individual in any job group is getting the benefits of this health insurance. We look at the health service delivery. This one was also discussed in community health 2 and community health 3 in bits, but it is important. Of importance is you as a clinician, as you step out, the health service delivery has different aspects or different functions. Although we are tuned to believe that only clinicians are subjected to the primary health care, but there are other levels and other means that is important that you get to understand how service delivery is done in Kenya, so that you can set up yourself in terms of further learning as you in pursuit of your career line. You can we can look at the parts of research. As a clinician, you can go to research, go to big organizations like Cambridge that do research. How do you publicize yourself? How do you get involved in the delivery when it comes to research, apart from the daily activities that we take as clinicians? Then we look at the health workforce. This one we look at the cadres, and in mind, this will come in importance because now Kenya has shifted from the past whereby devolution came in. How are we evolved in a county? How do you go to the CCO for health? What are the other cadres that are involved in the health workforce within? How do you, if you want to get a study leave, there are so many issues that come in within the health workforce. Health facilities, this is common, we understand the levels of facilities that we have, but more into this as you proceed to your rurals, get to know which health facility is that, which level of facility, which are the services, which are the staff that are recommended or need to be there. We want to look at quality assurance mechanism, and quality assurance mechanism is a key thing nowadays when we want to improve the quality of health in what we do and what we deliver out there. What are these tools that are required to provide quality assurance mechanisms? So we have elements, very important, and they will help us. Lastly, we look at home-based care. Home-based care is still, if you read at the UHC, it's part of an addendum to UHC, whereby HPC, we want to understand the objectives of home-based care. How do you do home-based care? You as a clinician, you need to know in Kenya, these home-based care facilities that exist, how do you set up your cell, what are the principles, how is infection control done within a community, how is infection control done when it comes to home-based care, and all these diseases that are covered in HPC, then advantage and disadvantage of this. Meanwhile, I will also share notes in the group platform because these are not complicated things for you to read and understand by yourselves. All right. Okay. Do you have any question up to that? As I said earlier on, this was the first session that we are interacting online. It's very important that we all agree, mutually agree that at any given time that you're called upon to, I will expect most of you to join. I believe right now it's probably half of the class, but it will be important everyone joins. I will be keen on this attendance because at some point we have to be serious and bearing in mind, and as a parent